Hi everyone, thank you so much for being here with us today and listening to what we have to say here at VR for Veterans. Today we're going to be talking about an issue that happens at many different companies, but is currently happening at our own. And we want to address it, we want to stop it, and if it does happen again, we want to make sure that we have the appropriate tools and resources to make sure that there's the best possible outcome. Today we're going to be talking about inadequate training. It has been shown that inadequate training is not good for a company, and training the employees to the best of their abilities is always going to turn out better. And this has been proven actually, with a 24% higher profit margin than other companies. It is shown that when you invest in your employees, who is our therapists, when you invest in them, the outcome will be much better because they're properly trained, better equipped to handle situations with different patients, and overall they are just much more happier because they understand what is going on. And we want to make sure that our therapists have the best time at our company and have the best relationship with their patients, because ultimately that is one of the most important things for how our company runs. Now, this problem is being addressed because it has been shown that some of our therapists are not at the skill level which they should be. There have been reports that our therapists do not know how to handle situations to the best of their abilities, so being a little bit insensitive and not responding accordingly, and also having problems with the technology. We are virtual reality based, so we have a ton of equipment to deal with, so it is important that our therapists know how to deal with it properly. This issue is very important and needs to be addressed because this can really affect the patient's time at our company, the patient's progress, and we want to make sure that they have the best possible time here. Next, Ben is going to be talking about ways that we're going to improve it.
Thank you, Deja. Looking forward to the future, our company wanted to find a solution that focused on 4 key aspects. The first one being candid, followed by committed, contrite, and compassionate. Looking at the first aspect, candid, our company wants to hire or build a public relations team as soon as possible. This way we can begin directly communicating with the public about any misinformation or confusion they may have. This allows us to be very straightforward about our solution and allows us to be very clear and concise with the public. Now, moving on to the next aspect, committed, we are installing a 1-week-long training program that all new or old employees have to undergo. This training program will make sure that all employees follow company policy and that they are able to serve their clients to the best way possible. This way we can show that we are very committed to the solution, as we have a 1-week training program that will last for the rest of our company's lifetime, with it being new or old employees, that each one will have to undergo at least 6 months. Now, moving on to the next is contrite. We feel very sincerely sorry for all of our consumers who were affected during this situation. So for this, we are reaching out to each one of them individually to see if we can help them with anything else, or if we can do anything to make it up for them. This way, we can show that we are emotionally invested in the situation and we truly care about the outcomes and what happens to our patients. Moving on to the final issue is compassionate. Hopefully, over the first 3, candid, committed, and contrite, you can see that our 1-week plan and hiring a public relations team, as well as reaching out to the clients who were affected by the situation, shows that we are truly compassionate about the situation and we want it to be fully gone and never have any issues again. Now, moving on to the methods we will be using to find our solution, we wanted to look for other companies that had similar issues. Most of these relied in the medical industry, as most of our cases will come from there. Next, we will have Bryce talk about our first case. Thank you.
Thank you, Ben, for informing us about the 4 qualities necessary to bring VR for Veterans back to our full potential. Now we would like to share with you what happens when a company lacks these qualities. And our first case, involving inadequate training within the health industry, revolves around the necessity for commitment and candor within the work environment. In 1990, a young boy named Robbie Powell died at the age of 10, ultimately due to medical errors and neglection during an extensive procedure. Following the incident, his father was informed of his child's untimely death without any credible explanation. Robbie's father refused to let go of the lack of disrespect and lack of candor shown by the hospital and filed for a lawsuit. took nearly 2 years of legal troubles before the truth was finally uncovered, proving that the hospital had falsified Robbie's medical records. However, even after proving the truth, no legal actions were taken towards the hospital or the medical staff on duty. The European Court of Human Rights stated that doctors have no duty to give parents of a child who's died as a result of negligence a truthful account of the circumstances of the death, or even refrain from deliberately falsifying records. Although this is much less likely to happen in today's time, it is necessary to take a moment and reflect on how one would feel if someone they love died due to neglection from medical staff and then deceived of the truth by those in which they entrusted their care and support to. Any well-functioning facility with dedicated, compassionate, and candid employees could have easily turned this story into Robbie going home with his father after a successful procedure. When a company is committed to improving the health and lives of individuals, it is important for them to provide their patients with a staff dedicated to the same commitment and capable of providing the necessary services. Unfortunately, this only scrapes the surface of incidences involving inadequate training within the health industry, and Jay here is about to tell you about the concern of lack of training with medical equipment.
Thank you, Bryce. Now I'm going to be talking to you about our second case. Our second case is inadequate skill of healthcare professionals in using asthma inhalation devices. Asthma is a very serious condition that many people have due to allergies and pollen and all the other stuff that goes in the world around us. Many people need to carry inhalers with them if they have asthma. Inhalers provide an extra boost of oxygen to the patient when they are having that asthma attack. Over the past 25 years, healthcare professionals have been studied to see if they are properly trained on inhalation devices for asthma patients. This study was done across worldwide and not just in the United States to see if professionals were truly trained. This study showed that majority of the professionals in the healthcare industry are not properly trained when it comes to using asthma inhalation devices. There are 3 kinds of asthma inhalation devices: the meter dose inhalers, the spacers, and the dry powder inhaler. When healthcare professionals do not know how to use an inhalation device, that puts the patient at a much higher risk of death. If a patient does not know how to properly use it, then when they do have their asthma attack, they will not be able to survive. And that falls back on the doctor or the nurse who prescribed it. In the study, the hospitals that were examined showed a percentage of from 10% to 99% of knowledge on how to properly utilize the asthma inhalation device. If the doctor only knows 10% of how to properly use an inhaler device, the patient is not going to be safe. Next, Larry is going to be talking to us about how health IT personnel are also poorly trained in our healthcare profession.
Thanks, Jay. Our third case of inadequate training happened in 2011 at a MedStar Health hospital. MedStar Health hospitals are a chain of nonprofit hospitals that operate throughout the United States. And in 2011, a nurse was treating a diabetic patient and used a glucometer to test the patient's blood sugar. And after the test was over, the glucometer outputted a confusing error message that made the nurse think that the patient's blood sugar was critically high, while in reality, the patient's blood sugar was critically low. But an error message popped up and blocked the output of the glucometer. And then the patient was sent unnecessarily to the ICU, and then in turn was administered insulin, which caused the diabetic's blood sugar to drop even further. And this insulin caused the patient to slip into a diabetic coma. Eventually, the patient recovered and was fine, and the nurse was suspended for a short period of time, and MedStar Health issued an apology. As a response, MedStar Health hospitals updated their glucometer system, where if an error happens, the message does not pop up and block the output of the actual glucometer anymore. But more importantly, MedStar Health hospitals developed new training systems, And these new training systems use simulations, and they put their nurses through a bunch of different new training simulations that prepare them for all kinds of situations that they could be in while they're working. And now finally, Lauren will explain to you how MedStar's incident will help VR for veterans avoid issues that could arise because of inadequate
These
training.
3 cases mentioned by Bryce, Shay, and Lowry are great examples of how we can work to fix our similar problem. The purpose of conducting this research is to ensure that our therapists receive the proper necessary training to provide the best treatment possible for our patients. In case 1, Bryce discussed how a lawsuit was filed for negligence and lack of candor. This specifically goes against our CANDID criteria. If in this position, our solution would be to be contrite with the family involved, and even though we could not take back our mistake, we would work to make sure that nothing like that happens again. Jay researched case 2 about how healthcare professionals use their technology inadequately. This shows a lack of commitment not only to the patient, but to our company as a whole. If in this position, our solution would be to require that anyone who gives treatment passes a skills and knowledge exam. The last case, which Lowry touched on, concerns safety problems with health IT if users are not trained properly. Similar to case 2, this is clearly just a lack of knowledge and training. The hospital in this case implemented more simulation training for nurses, which passes the criteria for our company. If in this position, our solution would be ensuring that anyone handling equipment is more than proficient in their use of equipment and implement similar training programs like the hospital did. Performing research on these cases allowed us to formulate a solution we feel as a company will fulfill our purpose and decrease chances of the problem reoccurring. The method that we believe will be effective is implementing a yearly training course. Every therapist working for VR for Veterans will be required to take and complete a course that goes over bedside manner, equipment usage, cleanliness, and treatment protocol. Requiring therapists to be candid with patients allows there to be less room for confusion and liability. In the case that an unforeseen error occurs, it is so important that our therapists are taught how to be effectively contrite with the patient so we can mend grievances with the party involved. If our therapists are communicative, perform their job professionally, safely, and in a hygienic manner, customers are going to see that we are the utmost committed to their treatment and recovery. We believe that there's a difference between just being committed and being committed and compassionate. A good healthcare professional can do treatments and send someone on their way, but compassionate healthcare professionals help in a way that goes beyond graduating treatment, but through their recovery as well. Our mission at VR for Veterans is to walk alongside veterans in need through the use of innovative technology and guidance from highly skilled therapists to aid in PTSD recovery. In order to fully walk alongside our veterans, we implement our 4 criteria points that are used in every aspect of our company. We are contrite, candid, compassionate, and committed to our patients. Not only does this help us give them the best treatment possible, it lessens liability that our company could face. Thank you, CEO Tony Stark, for your time and attention. We will now open up the floor for any questions, and our team will be more than happy to give answers. Thank you.